Doctor's Place Academy. Anemia is a medical condition characterized by a decrease in the number of red blood cells, RBCs, or a decrease in oxygen carrying capacity of RBC. Hemoglobin is the iron-containing protein found in red blood cells that carries oxygen from the lungs to the tissues. Anemia can result from various causes, including blood loss, decreased production of RBCs or hemoglobin, and increased destruction of RBCs. The most common symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, and rapid heartbeat. Anemia can also have serious health consequences, so prompt diagnosis and treatment are important. Anemia can be classified based on various factors, including the underlying cause, the size and shape of the red blood cells, and the speed at which the anemia develops. Some common types of anemia include iron deficiency anemia, vitamin deficiency anemia, hemolytic anemia, aplastic anemia, and sickle cell anemia. Diagnosis. The diagnosis of anemia typically involves a complete medical history and physical examination, as well as laboratory tests such as a complete blood count, CBC, and peripheral blood smear. Other tests may also be performed, including a reticulocyte count, ferritin level, and iron saturation. Treatment. The treatment of anemia depends on the underlying cause and the severity of the anemia. Iron deficiency anemia is usually treated with oral iron supplements, while vitamin deficiency anemia may be treated with vitamin supplementation. Blood transfusions may be necessary for some types of anemia, and in severe cases, a bone marrow transplant may be required. It's important to note that anemia can be a symptom of an underlying health condition, so it's important to seek prompt medical attention if you suspect you may be anemic. Early diagnosis and treatment can help prevent serious health complications and improve your overall quality of life.